health promotion concept principles and action plan for NCD prevention. এই যে তিনটে সব কথাগুলো বলছি এগুলো ক্লিয়ার হয়েছে। আমরা আজকে what I will discuss health promotion, that has already been discussed, so I will not discuss today. The concept has already been discussed, principles has already been discussed, and action plan maximum portion has already been discussed. Today the remaining portions I will discuss in different way. Okay, last class I told you about the action plan. What is the main objective? Our main objective is to prevent NCDs. Is it non-communicable diseases? Now we should know first what are the risk factors of NCDs. Rather I should say what are the behavioral risk factors. Behavioral risk factors of NCDs. What are those? Number one, unhealthy diet. Is it? If we consume unhealthy diet, so there is a risk of developing NCDs. Number two, is physical inactivity, and number three, can anybody tell what are the behavioral risk factors? Number one, unhealthy diet. Number two, physical inactivity, and third one, use of tobacco. Fourth one, consumption or use, whatever may be, of alcohol, and last one, that is stress. So these are the 5 behavioral risk factors. These risk factors is very important to develop NCDs, non-communicable diseases. So what we have to do? We have to minimize these risk factors, okay, among the individuals, the groups, in the community as a whole. In order to reduce the risk factors, what we have to do? We have to prepare an action plan for prevention of these risk factors in the community. At the same time, we have to take the help of the government authorities for formulating policies and programs so that we can implement this. And next one, we have to think about how to implement, where to implement, who will be involved, these are the things. So to reduce these risk factors, we have to prepare an action plan, and at the same time what we have to do, once we prepare the action plan, then we will try to implement the action plan so that it can be possible for us to reduce these 5 risk factors. Okay. So let's see what are the points to consider to prepare an action plan. Okay. First one is program. What are the programs that are existing in our country or in our locality to prevent NCDs? We have to know, and we have to inform the people, we have to ask the people whether they have any idea about the program that are in existence in our community. So that is the programs. Then next is gap. Gap means the difference. What we want that the people know and what actually they know. The difference is the gap. We have to find out the gap. How we have to find out the gap? Through situational analysis. We have to analyze the situations. How we can analyze the situations? We have to ask the people or collect information about their knowledge about prevention of NCDs. Okay. Next is how we collect informations, from where we can collect informations, and what techniques we will use to collect informations. Then we told you that we have to reduce the risk factors. Okay. So, what are the opportunities? Where we can do it? Okay. Opportunities means where we can do it. Say for example, we can organize these programs in a school. Okay, that is setting based. We can organize this prevention and control program in among the adult people. Okay, so population based. So these are the opportunities. Okay. Then question comes about who will be benefited. That means to who to whom will involve. আমাদের involvement কাদের কাদের আমরা করব. When we will organize the program, who will be involved in our program? These are called the stakeholders. Then for whom we will do it? This is called the target audience. For whom we will do it? That means we like to reduce the risk of which group of people? Mainly, they are the target audience. Say for example, non-school goer adults, all adults or all students of schools, college, universities. So these are the target. These are the target audience. Then question comes, what will be our, that is 6, strategies, activities and resources. So we fix the target audience. Then what will be the strategies? What activities will perform? What resources will utilize? So this is the 6 steps. Once it is fixed, then where we will do it? Previously I told for whom we will do it, who will be involved, where we will do it, that is the venue. What message will disseminate? That means আমরা কি বলবো? What message will disseminate to the target audience as well as to the stakeholders. That is the message. Okay. We have to prepare the message, then we will disseminate, then only we will disseminate it. Then once message prepared, with this message we have to prepare the materials. Before that, what method we will use? That means how we will try to reduce the risk behavior of the target populations as well as stakeholders. The message, then next is methods. What methods we will follow? Is it lecture methods? Is it counselings? Is it group meeting? Is it seminar? Is it symposium? Is it role play? Is it colloquy? It depends upon the nature of the target audience, timing, etc. If the time is the second half, I mean afternoon, then group discussions. If the time is the first half, the phase, okay, in the morning sessions, then we can deliver lecture also. If a target audience is very important as far as this problem is concerned. Say for example, already a person is being addicted in alcohol. Then what method? That counseling methods will be more applicable. So we have to select the methods. This is about the methods or techniques. What materials we will use? That you have to decide. We have to select. Materials means, say for example, I am using these materials, LCD projectors. Okay. So whether we will use these posters, there are different types of IC materials. One by one, I will tell you. The different materials are there, say for example, posters, flashcards, pamphlet, leaflet, flip book, flip charts, TV, radio, internet, mobile, Facebook. Okay. So what materials we will use? And last one. Last one is indicator. That means what things, how you will say yes, our program is successful, our plan is successful. That is called the indicator. These assessments. Okay. Let us see then one by one these same things, the nutshells. Already these things have been discussed. So I will start my discussions. So that I told, I have written programs, gaps, opportunities, stakeholders, who will be target audience, strategies, activities, resources, venue, message, methods, materials and indicators. Okay, this is about the programs. First I have written program. People should know what programs are prevailing or what programs are going on in order to prevent NCDs. Next, I have written here, I told you what about the gaps. How to find out the gaps? Through situational analysis, we have to find out the gaps. That means first one, in order to find out the gaps, what data we will collect? We have to collect information about the knowledge about different health programs related to NCDs. Then I told you type of data will be collected. Data out of two types usually. One is qualitative, another is quantitative. So what type of data we will collect? Source of data, from where we will collect the data, whether we will collect the data from community people or along with the community people, from the healthcare providers, from the health centers, from the key personnel. Okay. Next is techniques and tools of data collection. How you will collect data? Either through interview or through survey. Next, this is about the opportunities, population based. Population based means we have to divide the populations, okay, like the young adult, old age, like this. And next one is setting based, whether we will organize in the colleges, whether we will organize in the community settings, whether we can organize our programs in schools, that is the setting based, or in workplace, and then issue based. Say for example, NCDs, okay, consist of so many diseases like cancers, stroke, diabetes, hypertension, all these diseases. So whether we will discuss about the prevention of cancers, prevention of diabetes, likewise that is issue based. Okay. Then stakeholders, that means the persons or the personnels will involve in our program, because their behavior also influence the behavior of the target audience. So who will be our stakeholders? Planners, policy makers. That is important. If we do not involve the planners and policy makers, so we cannot think about the implementation of the program, the legal thing, that is important. Then we have to involve the political leaders. If we involve the political leaders, automatically we can expect the support when we will conduct any program. Then healthcare provider, you have to involve them because it is related to health. Frontline workers, who are the frontline workers? Anganwadi workers, ASHA, formal and informal leaders who have to involve. Then religious leaders, school teachers, shopkeepers, NGOs, self-help groups and Panchayat Raj also. Next, about the target audience. For whom we will plan, for whom we will implement these programs? Adolescents out of schools. That means those adolescents who are not attending these schools, we have to organize program for them because we would like to reduce the risk factors of this category of populations. What for? For prevention of NCDs. Then again we can organize our program at schools, college and university students. They are the adult members. Okay. Basically nowadays these adult people used to eat unhealthy diet for their disease, and they also use tobacco, they also use alcohol. So it will be easy for us to reduce the risk factors of NCDs if we can implement the program among the school students, among the college students, university students. Then adult members, male and female, we can organize program for them to reduce the risk factors of this group of populations, and head of the family and decision makers, and last ones again for the elderly people. Okay. This is strategy. I do not want to repeat these things again. Okay. Straightway I will come to this venue. Okay. Up to before that, in the last class I have discussed all these things. Today I will start from the venue. Okay. Venue, where we can organize this program. We can organize this program in healthcare facilities, okay, then health centers, primary health centers, sub centers, health and wellness centers. So we can organize this program there. Then in the schools also we can organize the programs in the ICDS centers. You know, you have the idea about the ICDS centers, Anganwadi centers, where we will distribute khichuri, non-formal educations for the small kids. That is ICDS centers, that is Anganwadi centers. We will organize the program because lot of people will come to the ICDS centers, you can call them. Then workplace, workplace means the factories, the establishments, okay, the hotels, the restaurants. Then in any community hall of a community, then local club, we can organize the program local club. Railway stations, many people moves, many people stands, many people wait, okay. So we can organize this type of programs in the railway stations, and we can organize also the bus terminus or bus stand where people gather or assembles. And last one is approach roads. We can organize the programs in the approach roads. Now, interventions. We start about the interventions from the message. What message we will disseminate? What informations we will disseminate to the stakeholders, specifically to the target audience. What for? To reduce that 5 behavioral risk factors. What are those? I would like to recapitulate. Number 1, unhealthy diet, physical inactivity. Number 3, use of tobacco. Number 4, use of or consumption of alcohol. And last one is stress. To reduce the risk factors, first risk factor is key. Say for example, unhealthy diet. Now, you have to disseminate informations about healthy diet, what diet they will consume or we will consume, we should consume. Number 1, the food we can eat can be broken down usually into 6 broad groups. Number 1, protein, grains, dairy products, vegetables, fruits and fat. Okay. So, all 6 groups we have to consume. Okay. Now, which foods under these groups we should consume for healthy diet, okay, or as a healthy diet? Okay. Proteins, grains, dairy products, vegetables, fruits and fat. So, what will our message? Eat plenty of fresh vegetables and fruits every day. Eat whole grains and whole pulses. You have to clarify the meaning also, then only it will be easy for them to comprehend. Then their behavior may be changed, okay, as far as this unhealthy diet is concerned. Okay. Now, 6 food groups, these are very important to you to know, because you have to disseminate these informations to the target audience. Number 1, protein. What type, what type of protein you should consume? You means the populations, okay. Lean proteins like fish and beans. Perhaps you have the idea of the lean protein. Lean protein, that means the protein where minimum fat is there, okay, like fish, beans. Worst option, this is best options. Worst options as far as the protein is concerned, that is processed meats. What is your comments? What you will see? Okay, what you will tell? Avoid high fat and sodium proteins. Next is grains. What type of grains? Whole grains. Okay, cross, refined white flour. Whole grains. Why? Whole grains. Whole grains are rich in fiber, vitamins, minerals and phytochemicals. Then come to the dairy products. Okay. If you say dairy products, people will eat dairy products. But what type of dairy product is healthy? The best options, non-fat yogurt, মানে দই, যে দইয়ে ফ্যাটটা, দুধে ফ্যাটটা কম থাকবে, সেই দুধ দিয়ে দই তৈরি করে আমরা কনজিউম করবো বা খাবো। Full fat dairy products, that is chocolate milk, cheese, cross. Okay, avoid full fat dairy products. In that way, you have to disseminate information to the community people, so that risk factors regarding this NCD like unhealthy diet, okay, that is important. Then vegetables. What type of vegetables? Vegetable means non-starchy vegetables such as leafy greens, broccoli, cauliflower. What is the worst options that you should not consume or less consume? Starchy vegetables such as corn, potatoes and peas. Most vegetables are low in carbohydrates and high in fiber. If the people ask you why vegetables you will consume, then you will say most vegetables are low in carbohydrates and high in fiber. Next group is fruits. Fresh fruits for providing antioxidants and fiber. Okay. Worst is canned fruits have high sugar content. Okay. Canned and bottled products do not contain some nutrients as fruit. And last one is fat. We require fat. If we think about the balanced diet, then what we say, what is a balanced diet? A diet contains required quantity of carbohydrate, protein, fat, vitamins. Okay, but what type of fat you should consume? Unsaturated, not saturated fat. Unsaturated fat, that is mono unsaturated fat or polyunsaturated fat found in avocados, walnuts, etc. What? We should consume it because it lower bad cholesterol. Okay. Saturated fat ki kore? Increase bad cholesterol. So limit butter, cheese, gravy and fried foods. Look for the term hydrogenated. Where in the canned food or tin food or in the labeling hydrogenated is there, the word, then we should avoid that one. So, first risk factors was unhealthy diet, next is about physical inactivity. So, you have to be active. So, regular exercise is required. Number 1, make daily exercise as a routine that you have to percolate, you have to disseminate. What you will tell? Exercise for a period of minimum 30 minutes per day. Minimum 5 days in a week. It can be split into different intervals. Say for example, at a stage it is, if it is not possible for you people to walk 30 minutes, you can walk 20 minutes, okay. Then again you can walk 10 minutes, that is called intervals, okay. 30 minutes per day, 5 days in a week. Again question comes, step, in a minute, per minute, minimum 80 steps, minimum 80 steps. So, that is required. Form a habit of using stairs. যখন আমরা সিঁড়ি বেয়ে উঠবো, আমরা লিফট ইউজ সহজে করব না, ওকে। Include exercise in your routine work. Develop a habit of walking. When we will go to school, when we will go to college, when we will go to market, when we will go to our neighbor house to meet, okay, friends, okay. So, what will your message? Keep exercise keeps you fit and healthy. Then risk factors is alcohol, next will be tobacco, and last one will be stress. So, alcohol use is associated with disease of heart, liver, kidney, brain and cancers. Next, your message, alcohol has socio-economic effects apart from the disease part. Socio-economic effects also leading to the problem of family, compromising of essential goods and items. Alcohol is not accepted in general in our family members whose needs are compromised, that is children, wife, parents. We are not able to go to the market for marketing with our children, but we are going to consume alcohol, that is compromises. Children, wife and parents. If we consume alcohol, it predisposes accidents, fights and depressions. Here also you can see excess alcohol consumption increases risk of that. You have to tell, that you have to show with the help of that. Next I will discuss about the materials. With the help of the posters, we can show it to the community. What are the harmful effects of alcohol? Okay, road accidents, depressions, cancers, damage to the brain, birth defects, diabetes and cirrhosis of liver. Okay, excess alcohol consumption increases risk of. So, what will be our message? Single message, avoid consumption of alcohol and improve quality of life. Next, tobacco. Likewise, the same things you have to tell about the tobacco. That means tobacco contains more than 7,000 chemicals and about 250 are poisonous and harmful. At least 70 chemicals known to cause cancer. Use of tobacco products leads to disease of lung, heart, cancer and blindness. Use of, non-smoke form of tobacco, that is gutka, khoini, other chewing tobacco leads to cancer of mouth, cancer of food pipe and stomach. Use of tobacco by pregnant women leads to low birth weight and stillbirth. So, what will your message? Take home message we say, stop using tobacco and enjoy a cancer free life. That was about the cigarette I told, this is about the bidi. Same, bidis are also equally harmful as cigarettes. Tobacco use leads to impotence and low fertility. Person exposed to second hand smoke, that is again important. Second hand smoke, I do not smoke, I am not the smokers, but in front of me one person, family members or friends smoking, okay, I will be affected. That is called second hand smoking. So, persons exposed to second hand smoke suffer from cancer and disease of lungs. Young children in the family of smokers are prone to develop respiratory disease and disease of the air. And last one is stress, that is the behavioral risk factors. So, we have to cope stress as a human being, as an adult, as an old, as an adolescent, we will suffer from stress, but we have to cope it. How we can cope our stress? Practice yoga, pranayam, meditations regularly. This practice can minimize stress. Okay. So, that is about the methods, message, then methods and media. So, these things we have to disseminate, but with the help of what methods, how you can disseminate it? Number one, through counseling. If you see that case is complicated, already addicted either in tobacco or alcohol, or that particular person is not using healthy diet, okay, he is spending their time by gossiping, by sitting, that is leading sedentary lifestyles, you have to counsel him or her to change his habit, to change his behavior that leads to NCDs. Then group meeting, in a group, small group, you can discuss among themselves about the risk factors of these NCDs, how it can be prevented. That means, if we reduce the risk, automatically we can prevent the NCDs. Then role play by enacting, like a drama, but not drama, role play is different from drama. Okay. Then colloquy means we have to discuss these things in front of this target audience with the help of, you people will be there as a resource persons, with the help of other formal, informal leaders involving them. So, that is why stakeholder is important. Then exhibitions, you have to exhibit the things by organizing exhibitions about the menace of all these behavioral risk factors like unhealthy diet, lack of physical activity, use of alcohol, use of tobacco and stress. Mass meeting, you can alert the people about the different programs, about the menace, about the harmful effects of unhealthy diets, inactivity, use of alcohol and tobacco, its harmful effects, by organizing mass meeting, and again with the help of the puppet show. In Bengali we call it Putul Nach. With the help of the puppet show, we can motivate the people, we can alert the people about the risk factors of NCDs, how to reduce the risk factors by changing their behavior, like physical activity, like healthy diet, non-use of or alcohol, quit smoking and start pranayam, yoga, meditations for coping with the stress. With the help of this media also, this is media, televisions, we can telecast it with the help of the televisions. With the help of the internet also, we can disseminate all these informations. With the help of the mobile phone, we can motivate the people about reducing the risk factors that lead to NCDs. Then with the help of the social medias, through WhatsApps, through Facebook, we can help the people to reduce their risk factors, so that we can prevent NCDs by, with the help of this action plan, right from the program to indicator. I will discuss about the indicators. And last one is radio. We can use radio as a media for motivating people, for sensitizing people to become aware about the behavioral risk factors of NCDs, to prevent NCDs. and the materials. Okay. What are the materials that we can use? We can display the posters. Okay. We can display the posters in the approach road, in the railway stations, in the marketplaces, in the bus terminus. Okay. What I have shown about the diet, about the physical activity, regular exercise like this. Then we can use flashcards in the classroom situations when we will discuss, organize about these mass meetings or mainly group meetings. We can use these flashcards, we can use the flip book, we can use the flip chart, and we can display hoarding, you know, rasta dhare hoarding. We can use the hoarding by percolating by writing all these message. Then we can distribute the leaflet, we can distribute the pamphlet, we can prepare the folder and distribute it, and we can prepare the stickers and stick it into the on these vehicles, so people will see when the vehicle will move. And last one is indicator. Indicator means the indications. How we can say that our program will be successful. Look, our mission is successful. Assess the knowledge, attitude and practice of the community about the modifiable risk factors of NCD. Modifiable risk factors means that risk factors that we can modify. These are the behavioral risk factors, that is the 5. Again I repeat, number 1, unhealthy diet, physical inactivity, use of alcohol, use of tobacco and stress. So we have to assess the knowledge, attitude and practice of the community about the risk factors of NCDs. We have to assess the knowledge, attitude and practice of the shopkeepers, because people consumes everything, the materials, that means diet, food, tobacco, alcohol from the shopkeepers. So we have to assess the knowledge of the shopkeepers also, find out the tobacco cessation services at different levels, healthcare, find out the yoga practice centers in the community. Next indicator, what is this? Number of mass media campaign already organized for tobacco, alcohol de-addiction services at different healthcare facilities. Number of mass media campaign organized for healthy eating, implementation of guidelines for healthy food in restaurants and eating places to include NCD issues, implementation of mass media campaign for promotion of physical activity, implementation of school health guidelines in the schools, implementation of healthy workplace guidelines at different workplaces, mass media campaign and IC materials for healthy food and regular physical activities, and mass media campaign and use of IC materials for clean fuel use. So that is all about today's discussions. I recapitulate for 1 to 2 minutes, couple of minutes. Number 1, NCDs. Today's our objective was, at the end of the sessions, you people will be able to state that yes, action plan is required for prevention of NCDs. Okay. Now action plan. So first we have to think about the action plan, how to prepare an action plans. There are 11 points that has to be considered in action plan. Number 1, first the programs. What programs are existing? What about the knowledge of the community people, about this program as regards to NCD is concerned. NCD prevention and control is concerned. Okay, that is the program. Then next one is gaps. How to find out the gaps? Gaps means what do you want the people should know and what they know. How we can find out the gaps? By collecting relevant informations, by collecting data from the community people. Okay. Once we find out the gap, then question comes, what are the opportunities or what are the places where we can conduct this. Okay. And next, think about stakeholders to whom we can involve all the stakeholders, right from the planners and policy makers, then political leaders, all the informal, formal leaders, shopkeepers, religious leaders. Okay, these are the stakeholders, including the PRI. That means those who are directly or indirectly benefited. Okay. Then who will be our focal point, that is target audience. Who are the target audience? Mainly adolescents, school, college, university students, all adult members, elder people, head of the family and decision makers of the family. Okay. So that is the target audience. Once target audience fixed, then the strategies, how we'll move forward to take actions. What are the resources that are available, that are required to implement this program? Okay, once strategy is fixed, then question comes, preparation of the message. What informations will provide to the community people by indicating why. These are the food we should eat, these are the foods we should avoid, why we should eat it, why we should avoid it. Okay. Then about this message regarding all 5 risk factors, about this healthy diet, physical inactivity, alcohol, tobacco and stress. One message is prepared, then with the help of the message we have to prepare the material, because these materials will be required. What for? As a reminder. As a reminder, like handouts we will give to you sometimes, you will writing down, we are showing this slides to you for reminder. Okay. Then comes about the places where we will organize it, and last one is indicator. That's all. Okay. So we have finished it. Concept of health promotions. Number 1, in the last class I discussed what is health promotions, what are the action areas of health promotions, principles of health promotions, and then NCD preventions. Okay, action plan. Thank you very much.